Hello, this is Jan Raymaker with PACO 611, and this assignment is called the Trauma Counselor Assignment and Interview. The counselor is Frances Norton with BetterHelp.com. The first question is how trauma impacts brain development. The effects include leading to difficulties with trust, intimacy, communication, and it hinders the ability to form relationships that use secure and are secure and disrupts attachment. Explain the role of the amygdala, hippocampus, and prefrontal cortex in processing traumatic experiences. People with post-traumatic stress disorder have a smaller hippocampus and increased amygdala function. Abnormal functioning of the amygdala and hippocampus neural circuit may add to trauma-related abnormalities of memory and difficulties contextually. The prefrontal cortex functions in a way that is less effective. Explore how the concept of neuroplasticity offers hope for children who have experienced trauma. The brain has the ability to heal, adapt, and form positive and neural pathways despite the effect of adverse actions. Whole brain approach to trauma recovery. Discuss at least 3 strategies for helping children process and heal from trauma. Stable relationships help, as well as expressing feelings through drawing, play, talking, as well as positive activities. How can parents and counselors or educators use strategies to support child's emotional resilience and regulation? Keeping routine is helpful. Be aware of signs that help is needed. Students who deal with inability to function due to intense sadness, anger, or fear need a referral to a mental health professional. Illness could show up in a form of a headache, fatigue, or tummy ache. Neuroscience trauma. Explain how trauma and chronic stress affects the ability of the child to regulate behavior and/or emotions. How can parent or counselor educate or use strategies to support a child's emotions and resilience and regulation? Educators, counselors, and parents can foster children's regulation and resilience emotionally by providing a supportive and safe environment. This is done by learning strategies that give coping skills such as deep breathing as well as mindfulness. Healthy emotional responses can be modeled, and openly communicating can help a child in developing skills with problem solving and a mindset of growth. Independence and confidence grows using routines, offering outlets when efforts are acknowledged. What role does therapy or expressive arts therapy play in trauma recovery? Expressive arts therapy aids in recovery of trauma by giving a nonverbal way that is symbolic to process through experiences and emotions. This involves complex ways to reconnect with self. It helps to grow self-awareness and builds resilience emotionally and grow mechanisms to cope that language by itself cannot tap into. How can somatic-based approaches and mindfulness aid in healing trauma in childhood? These approaches foster releasing tensions and self-regulation and grow mind and body awareness. This aids to restore balance in the nervous system and build resilience to fight against stress. Somatic tools give the child ways to bring connection to the body and emotions using movement and breath work. This leads to a recovery process that is holistic. How can schools and churches build environments that are trauma-informed to give children support in the process of healing? Focus should be concentrated on trust building, relationships, growing predictability, and safe environments, and give support emotionally through routines that are consistent, spaces that are calming, and learning that is social emotional. Triggers need recognized, and empathy should be used in your response. Self-care needs priority. Partnering with professionals involved in the mental health is needed, as well as giving emotional and spiritual tools for coping. How do scriptures like Romans 12:2 and Psalms 34:18 align with trauma and healing? These verses give hope and comfort. Transformation framework. Solace is given by Psalms 34:18 as it affirms the presence of God and care for those that suffer, letting them know God is with them. Romans 12:2 gives encouragement to the believer to be transformed by scripture immersion and letting God's hope and truth replace beliefs that are trauma-induced. Deeper faith is fostered and the healing process is supported. An empowered perspective gives ability to cope with the past, and a renewed identity is found. Explain how trauma and chronic stress affects ability of the child to regulate behavior or emotions. Trauma and chronic stress inhibit a child's ability to regulate emotions and behavior by disrupting brain development that is normal. This has a weakening effect on important neural connections, and this changes the stress response system physiologically. The brain goes into a survival mode instead of being able to learn to manage their emotions. The outcome is emotional numbness and overreactions in the way they respond to daily situations. How can biblical principles be integrated into counseling children who have experienced trauma? Safety and trust needs established. Children should feel safe and secure so experiences can be shared without using judgment and growing a trusting foundation. Prayer needs incorporated. God's presence should be invited into the space that is healing, building an environment that is sacred for the process of transformation. Wisdom is found in scriptures. Verses used should talk about hope, strength, and the love of God. Isaiah 41:10 gives reassurance, guidance, comfort during rough times. Prayer, as well as reflection, helps kids to seek God's strength and process the effect trauma has on their godly relationship. The whole child is nurtured. What role does faith and prayer have in the emotional process of healing? Prayer and faith give hope, solace, and inner peace during healing emotionally by fostering connections to the big picture, giving back control, stress reduction, community ties are built. Practice like this offer mechanisms to help with coping, aiding people to process emotions that are challenging. A renewed perspective gives ways to cope with challenges using an outlook that is positive. How do relationships and communities contribute to a child's recovery, both from a psychological and biblical perspective? A child's recovery is fostered by community and relationships to offer benefits psychologically, such as resilience, security, and increased self-worth. By offering an environment that is supportive, this is God's design for mutual support and fellowship, giving families and children ways to lean on each other, to give guidance and encouragement during times that are challenging. How do churches and Christian counselors balance biblical counseling with evidence-based psychological approaches in trauma care? This is done by integrating clinical techniques with biblical truths and trauma-informed care. The whole person is treated, including body, mind, and soul. Cognitive behavior therapy, used by a licensed professional, along with faith-based perspective to treat both spiritual and psychological issues that appear from trauma. This creates a path for holistic healing and well-being for the long term for communities and individuals. This has been Jan Raymaker with Paco 611.